treating nosebleeds. Well, I just learned on the doctors the other day, just today in fact, that when you have nosebleeds, oftentimes it's happening not in the back, but in the front. And 90% of the nosebleeds that happen in the front, you can lean forward, apply pressure on your nose to help the blood clot. Make sure you haven't taken any aspirin. Well now, some, other than children, some adults that have a nosebleed in the back of the nose, those can be more dangerous and be severe. For those, you may have to eventually have it treated by a doctor. They'll send kind of a balloon in there into the nasal passage and try to help it clot up. Well, nosebleeds can be very scary, scary, very scary, hairy, hairy, scary. Watch out for nosebleeds. Who knows what can happen? These better get treated very soon. Yeah, ho, ho. Well, they went through it and showed a diagram of the nose. Well, I would be careful if I were you. Oh, try moving your head forward and applying pressure on the nose for 5 to 15 minutes. And if that doesn't help, try it again. If that doesn't help, go to a doctor right away. It may be posterior instead of anterior, anterior, anterior. You gotta watch out if it's in the back. It's connected to the territorial artery, so there could be a good amount of blood flow. So you better get it back, get things clotting the way they should, the way the blood should clot. Then the blood will stop flowing from your nose. That's a thought.
Healthy weight, be active, exercise. Losing as few as 10 pounds could lower your heart disease risk by up to 50%. We've talked about on the show before, eating nuts, which are loaded with good fats, fruits and vegetables, lean proteins, that may help reduce your risk of heart disease by up to 80%. And those are the kind of steps that will help lower your cholesterol, because cholesterol builds up over time in the walls of your arteries. That's what leads to heart disease and heart attacks.
Now, we received an email from the viewer, and it reads, "Hi, Doctor.
Cholesterol builds up over time in your arteries.
Is that true?
That's what causes heart attacks. So you got to get it to zero.
Unsaturated fatty acids, and a lot of thoughts as to what they do in the body. Anti-inflammatory, they make your platelets a little less sticky. We're showing animation here because, again, obviously, you do want your blood to clot, like when you have a nosebleed, which we just talked about, but if it clots too easily, it can increase your risk for heart attack. Here to give us a better understanding of omega-3s is Dr. Suzanne Steinbaum, cardiologist and the director of Women and Heart Disease at New York's Lenoxville Hospital.
Welcome. Thank you. Well, let's talk about diet, because diet is a big part of being heart healthy. And part of a heart healthy diet is actually incorporating omega-3s in your diet. And you could get them in salmon, you could get them in walnuts, but a lot of times it's important to take a supplement every day. And that's one of the things that I recommend to my patients, is actually to take an omega-3 supplement every day. I've been working with the spokesperson for Shift Mega Red, which is a krill oil supplement as opposed to a fish oil supplement.
What's the difference between krill oil and fish oil?
The way that it's made is with a phospholipid outer layer. And that's very similar to the cells inside the body, so it's very, very easy to digest. A lot of times you'll hear people say with fish oil they have burping, it's difficult, they can't take it, it makes them gassy. This is not exactly the same. It's more easily absorbed and easier to take. And it's actually concentrated, so you don't have to take as much. So 1 pill a day is enough.
Nice. And we always talk on the show, if you're going to supplement your diet, you'll always want to talk to your doctor. And there's a reason for that. If you have things like bleeding disorders, allergies, any other risks with these supplements?
I mean, it can increase your chances of bleeding and bruising, because it slows down the blood clotting. And like you mentioned, it can interact with other medications, other supplements. So, just make sure your doctor knows whatever you're taking.
You want your blood to clot,
people believe is
like
that
if
if
you
it's
got
something that they buy
a
that's
bleeding
over the
nose.
counter,
But if your
that they
blood
don't
clots
really
too
think about
easily,
it. And that's not
well
true
then
because
that
it
could
interact
also
with
throw
medication, so it's really
you into the risk category for heart disease or a heart attack. So you want to watch and look at.
2012 Healthy Heart Challenge coming up. Is there a new hidden danger in your canned food? Stay with us to find out.